in our response to the pandemic, the likes of which we have not seen in America since the 1918, so over 100 years. So there are very few people alive that have dealt with this. But thanks to the work of these two gentlemen that are at this table with me today and their teams and people all around this state, as I have said repeatedly, these in many ways are the worst of times, but in our state we have a long history of the worst of times bringing out the best of our people. And I know that's exactly what is happening right now. You know, we've had a real conversation over the last several days regarding testing, for instance. That's something that is critically important. We have talked a lot about the things that we are trying to do to take an offensive approach to this virus. The defensive measures that we've put in place, obviously with respect to our social distancing guidelines weeks ago, our shelter-in-place order, first one announced a couple of days ago, the statewide announced yesterday, are all going to help slow the spread of this virus. But we also know that we need to take offensive measures. Part of being offensive with respect to this includes making sure that we are doing tests, and which would then allow for our State Department of Health to implement their identify and then isolate strategy. And so I wanted to give you some numbers. I had estimated a day or so ago that I felt like Mississippi, from a testing standpoint, had done well compared to many of the states around the country. At that time, I probably did something I shouldn't have, and I estimated that the private labs probably had done at least as many tests as we had done at the state lab, and therefore the reporting that we had done of approximately 5,000 tests at that time probably was at least 10,000. You've also heard us talk about the model that we're utilizing from a proactive approach includes looking at other countries and what they've been able to do. And as you know, in most other countries, and really it became a standard at one time that some of the South Korean model, in terms of the fact that they had tested somewhere in the neighborhood of 5,200 of their residents per 1 million. What I will tell you today is thanks to Dr. Dobbs and his team, they've been able to, and in large part thanks to the Congress acting the latter part of last week and requiring all labs to report to the CDC. We do have additional data today. What we found is that in my estimation a couple of days ago, I really underestimated how many tests that the private labs had done for Mississippians. We are now projecting that we have seen approximately 16,662 total tests in Mississippi. Obviously, we have 1,177 total cases after the reporting from yesterday. And with our population being approximately 3 million people, you can see that from a testing standpoint, we are at that approximately 5,400 per 1 million residents. But what I will tell you is we are continuously ramping up testing. If you go to the Department of Health's website, what you see is a list, and I had it printed out for me. It's over 10 pages long. There are approximately 20 sites on each page. So there's approximately 200 sites around the state. In addition to that, we have mobile testing units that are jointly run by the State Department of Health, UMMC, the Mississippi National Guard, in conjunction with the Mississippi Emergency Management Agency. And so we want to continue to bump up the number of tests that we do. Just to put things in perspective, in terms of total tests, the reporting that is being made now, it appears, and again, these are what has been reported. The state of Indiana has done approximately 14,375 tests. Their population is twice ours. Virginia has done approximately 15,000 tests. Their population is approximately 3 times ours. Kentucky has about 1.5 million more residents than we do, and we've done approximately twice as many tests as they have. Again, from a testing standpoint, I've got to give it to the State Department of Health and their partners. We have been very aggressive in testing. We have done very innovative things with our universities, particularly with University of Mississippi Medical Center. They already have one testing unit online, which is helping us grow the number of tests every day and the in-house capabilities at UMMC. You've got similar work being done at the University of Southern Mississippi, where they're working very hard to bring theirs online as well. That is in addition to, of course, the work that's being done at Mississippi State University to convert those 500 ventilators from battery operated to where they can actually be plugged into a wall. Now, keep in mind when I talk about testing that every state is in a different point in their cycle. We understand that we are ahead of the curve on testing, but we also understand that the total damage from this virus outbreak is going to get worse before it gets better. We have a high number of cases, and we know that, but I do want to brag on the healthcare workers and the scientists who are leading the effort in Mississippi to help us continue to significantly increase and enhance our testing capabilities. To be honest with you, I'm inspired by the work of all of our hospitals and our labs to get even more testing done. I appreciate them, and the reality is for us to make the best decisions possible, we need the best data possible, and for us to have the best data possible, we've got to have the best people in the state working to ensure that we provide that, and that's exactly what's happening, and I'm honored that all of these healthcare workers and all of these folks in these public health labs and in these universities are on our team, because I can tell you there's a lot of innovation going on around the country, and there's a lot of innovation going on in Mississippi to help us respond. Now, I want to say a few things to be perfectly. Now, earlier today, I have had very well attended phone calls with our mayors and board of supervisors across the state to talk through our local enforcement measures. I will tell you that the shelter-in-place order that I put in effect yesterday will be enforced. Local leaders are very serious about making sure no one willingly violates this order. Now, I also want to be clear. I want you to think of these shelter-in-place orders similar to you think of the speed limit. You know that there are those who are driving 66 miles an hour in a 65 that are probably not going to get pulled over either by local law enforcement or by state law enforcement. The people who are the most dangerous, though, are the ones who are driving 25 miles an hour over the speed limit and barreling through stop signs. Law enforcement is out looking to stop them. If you want to take a walk, or if you need to drive to the store to get supplies, medical supplies, food, the grocery store, you don't need to be worried. You do not need any kind of special card or any kind of paperwork or any sort of voucher to go out for essential travel and essential activity. We've tried to outline for everyone in multiple executive orders publicly what essential businesses are. We're not going to be able to go in and do our own individual legal analysis for every single company. Locals who are closest to the issue will make enforcement decisions and interpret the order just like they do with every other single law that is on the books. If you just continue to say, if you think you might be on the bubble, you may not be essential. Those are decisions that have to be made by employers and by local leaders, and we're going to provide them as much clarity and information as issues pop up. But I will tell you what I told the local elected officials. I trust them to take the point of the order and enforce them at the local level. Every disaster, and the Vice President loves to say this, they are state managed but locally executed and federally supported. When natural disasters such as this occur, that's the way in which our model in this country is set up, and I'm confident that the people at the local level will make good decisions for our constituents. Obviously, we have to protect the supply chain by making sure our essential businesses continue to function. Many of them are going to extraordinary lengths to protect their workers. To all of you, I say thank you. I know there are some bad actors, but I want to recognize those, and it's the vast majority around the state that are doing their best to comply with social distancing, with making sure that we have good hygiene. Most Mississippi businesses are taking care of their own because we love one another. Now, one of the questions that I've gotten on social media, maybe more than any other, is regarding fishing. And what I want to tell you is if there is an opportunity for you to get to a pond or a creek or a lake and go fishing in a boat by yourself or maybe with one other person that's 6 feet away from you, by all means, go do it. In fact, I wish I had some time to get out and go fishing. Now, what we as a state have done is we have shut down some of our public parks and some of our areas, such as the reservoir. And the reason that we have done that is because the law enforcement officers that would normally patrol those areas, we need them to help supplement local law enforcement to make sure that our orders are being conducted and are being enforced in a productive manner. We also know, whether it's on the Mississippi Gulf Coast, out on the islands, or upriver on the Pearl River, we have beautiful places to go, beautiful sandbars, beautiful beaches on the islands. The problem is, what happened over the weekend is that in many of these places, there were groups of 11 or 12 or many more than that. And that violates not only the spirit of the executive orders, that actually violates the law that is in place. And so some of these state-managed waterways will be shut down, but we want you to get out and enjoy yourself. We have encouraged individual outdoor activity, and if you can perform whatever activity from an individual standpoint and do it without putting yourself or others at risk, that is perfectly acceptable. I will tell you that I've asked some of our officials to, again, try to figure out how we can potentially reopen some of the state waterways as we move beyond this to ensure that the spirit of the order is taken care of, and we're working on that, and we'll continue to update you as we move forward. The final thing I want to update you on before I turn it over to Dr. Dobbs and Director Michelle is today is Thursday. That means unemployment claims came out. Prior to last week, the most number of unemployment claims in the history of America, since we've been keeping this on a weekly basis, in any 1 week was 700,000. Last week in America, we had the largest number ever on record. That was 3.3 million. This week, as was announced this morning, we no longer have 3.3 million as the largest number of unemployment claims in the history of America. Today, there were 6.6 million unemployment claims. To put that in perspective, in our state, 2 weeks ago, a typical week in Mississippi, we had slightly less, or approximately 1,000 unemployment claims. Last week, we had approximately 5,500 unemployment claims, 5.5 times what we had the week before. This week, we had approximately 30,000 unemployment claims. That's 30 times the number of claims from 2 weeks ago. Make no mistake, this is not only a public health disaster, this is also an economic disaster in Mississippi and in this nation. What I want you to know is that we understand that with the workload at the Department of Employment Security being 30x compared to what it was 2 weeks ago, I just ask you to be patient, put yourself in those employees' shoes. If when you are at work, if someone came to you and said, I need you to do 30 times what you're doing today, tomorrow, for us to be able to handle the volume, 30x up that much. The reality is we are implementing measures to hire more people, to hire temp staff, to increase the number of folks. For instance, we've gone from a call center that was open from 8 to 5 days a week, to a call center that is now open from 7 a.m. to 10 p.m. 7 days a week. We have allowed our WIN job centers for the first time to accept applications, even though they are closed to the public. They can accept unemployment insurance applications online, and then you can be helped in that regard. But remember, no matter when we are able to process your claim, I want you to know you are entitled to benefits based upon the first day that you were laid off, and that you will be paid based upon the date at which you were laid off, not the date at which you actually get your claim approved and filed by our state. We are putting in more measures to hire additional people to deal with the significant uptick in claims, and we're going to make sure that you are able to get through. We're going to make sure that you get what you are entitled to, because it's not your fault that COVID-19 has led to this economic challenge, and we're going to stand with you as a state. Now, as we continue to work to protect the people of Mississippi, we're continuing to do long-term strategy planning to deal with the possible scenarios that exist. And so at this time, I'm going to turn it over to Dr. Dobbs and just give him an opportunity to address you as well.
Thank you, Governor, and thank you for sharing the lab data that we have made available today. We will look forward to sharing more regularly the total lab volume for the state of Mississippi. Our state public health lab and private partners have done a fantastic job making testing available to everyone who appropriately needs it. We have a network of over 126 private clinics that have designated themselves as locations for specific COVID testing. Now, any doctor's office can do COVID testing, and a lot of them do, but we have on our website a list of all these locations across the state where you can go if you think you need COVID testing. In addition, we have our mobile test sites, which we have activated across the state and going into areas that are either hotspots or have maybe specific geographic need. Also, we have other fantastic partners like UMC, which has set up their drive-through clinic here. So we have pretty good availability of testing, but expect to see more. We really want to ramp this up so that we can diagnose every single case if possible, and make sure we take those public health actions needed to sort of stop this thing. We have a total of 1,177 cases thus far today, with 26 deaths. This morning we reported 104 new cases. Now, although that is significantly lower than the number of new cases reported yesterday, I would not be lulled into a sense of complacency. There's been a lot of variability in that, and we expect we'll continue to see more and more cases as the weeks go on. Certainly, we do not have any sort of confidence that we've peaked out at all. Expect to see a lot more cases and a lot more deaths. And then the more sobering number that we have seen, 22 long-term care facilities that have been impacted by COVID, and that's something that's going to take a lot of our resources and a lot of our attention to make sure we protect those who are most vulnerable. If we look at those who've died in Mississippi, the vast majority are over 60, 17 of them are over 70, and 5 are between 60 and 69. So it's really going to be these older folks like we talked about who are going to be most susceptible to the severe outcomes and death. And we have a relatively high hospitalization rate at 30.6% of all of our diagnosed cases to date. That's really all I had to share today, and thank you, Governor.
Thank you, Dr. Dobbs. Director Michelle and his team have been leading the effort to improve the amount of equipment and supplies that we're getting into the state. We have received small shipments from the national stockpile several weeks ago, but nowhere near what we have requested. And so we have done what Mississippians do. We have taken it upon ourselves to go out and work very hard to place orders to get supplies in. And I'm going to turn it over to Director Michelle to talk about that.
Thank you, Governor Reeves. I'm pleased to report that we are starting to receive the PPE shipments, and we hope to steady receive these throughout the rest of the weekend and going into next week. So just to give you a report and update on what we've got in the last 24 hours, 18,000 surgical masks. Those are masks that we were able to get from Mississippi companies there. 25,000 N95 masks, 10,000 Tyvek suits for our healthcare workers, 2,500 bottles of hand sanitizer. These would be bottles that we would be able to place with our first and emergency responders, and then 15,000 test tubes to assist with the lab supplies to assist Dr. Dobbs and his team in testing. So we are starting to get supplies in, and we're anticipating those shipments to come in regularly from this point forward now.
Thank you, Director Michelle. I'll just point out Dr. Dobbs mentioned the number of cases in Mississippi today, which were a little bit less than yesterday, and that's obviously encouraging news, but not one day does not a trend make, and we don't expect that is the trend and the direction that we're headed in. Just for your perspective, understand that yesterday the state of Louisiana had said that they had 1,212 new cases. Today they are reporting 2,726 new cases. So they are now 5th overall amongst all 50 states in total number of cases. For all intents and purposes, they're up. They've got 9,150 total cases, and they're up about 4,000 in the last 2 days alone. Now, as I've said repeatedly, total number of tests per state at this relatively early stage for many is more a function of how many tests you're doing than it is necessarily what you necessarily where you're headed. But there is no doubt that the city of New Orleans and Orleans Parish is a hotspot in America. It's the reason they have received significant federal resources. We certainly pray for our friends and our neighbors to the west, but we also understand how this virus can spread and spread very quickly, particularly if individuals are not practicing social distancing or not staying at home, if at all possible, and only getting out for essential travel or for essential work and operations. So with that, thank you all for being here. I appreciate these two gentlemen for being here as well, and I will open the floor to any easy questions that y'all have. Courtney Ann.
I know that you talked about speaking with mayors and they're going to do what they can to enforce these measures at the local level. We've had a lot of questions, just folks at home who maybe haven't read through executive orders in the past that are trying to figure out, well, why is my local municipality issuing an order that seems very much the same as the governor's? Those are just intended as reinforcements, or what do you want to tell those people at home who maybe are seeing what feels like a duplicate at the local level?
Well, for those of you who have never read an executive order with respect to a pandemic in Mississippi, I will tell you that none of us have ever actually written an executive order dealing with a pandemic in Mississippi. And so we are all in uncharted waters and uncharted territory. What I would tell you is many of the local orders that are being put in place are very similar to the executive order that I signed yesterday with my shelter-in-place order. Some are a little bit different, and look, different municipalities and different counties have different means and different needs, and it is certainly perfectly acceptable for them to do that. It is okay for them to go a little bit further or try to take additional steps or be more specific in their order if that's what they think their citizens need. What they can't do at the local level is they can't conflict with the executive order that we signed yesterday. So in other words, when we say that you are an essential operation, most of which are defined by the United States Department of Homeland Security's Cybersecurity and Infrastructure committee, those are essential operations that must stay open. And so, but look, we had great conversations with our mayors, with our supervisors today. I will tell you, I've been extremely pleased with all of them. Republicans and Democrats alike are trying to pull together now and work to protect our fellow Mississippians. So again, the simple answer is, if you have to think about you ought to do something or not as an individual, the answer is probably no, you probably shouldn't do it. But there's nothing wrong with getting outside your house and by yourself, working in your garden, or working in your flower bed, or walking around the neighborhood by yourself, or with your spouse or your kids, as long as they're 5 or 6 feet away from you. For mental health reasons, we need to get out and enjoy this beautiful April weather, but we need to do it by ourselves.
You mentioned, Governor, that some waterways are going to be closed down. With Ross Barnett Reservoir being the largest inland body of water, and it borders the Natchez Trace, whose jurisdiction? Because yesterday there were lots of folks who were partying alongside the trace, adjacent to the water. Whose jurisdiction is it to cover and take care of that?
Well, what I would tell you is depending upon exactly where you are, we certainly allow reservoir police has jurisdiction, for instance, on the east side of the reservoir. You've got, when you're on the waterway, typically it's Department of Wildlife, Fisheries, and Parks oversees that. We've got federal law enforcement officers when it's along the Natchez Trace that are involved. And what we are willing and able to do is, if locals would like help with enforcement, if you go through your local emergency management team, they can then reach out to the state, to the Mississippi Emergency Management Team, and we are prepared and able to deploy additional state resources to help in this effort. Now, look, if there's a group of 11 people that are gathered up at the reservoir, first of all, I'd say don't do that. Please do not do that. You're putting yourself and your friends and family at risk. But if there are, what I hope will happen is that local law enforcement or state law enforcement goes and breaks up that group and tells them to go home. I don't think we're going to see significant arrests initially, unless you ignore doing what you're supposed to do. Gerald?
You touted the number of testing, and I guess this is a question with Dr. Dobbs. Can you project at what point can we begin to do testing, random testing and sampling, or open the testing availability? Is that something you're able to project at this point?
You know, certainly we want to expand testing as much as can be done, and there'll be different modalities of testing, like antibody testing, which will have a different role. So there'll be more and more testing out there. Except for certain very specific circumstances, there's really no use in checking asymptomatic people. It's just a wasted effort. But certainly we have recognized that the degree of symptoms is highly variable. And so we really are and have been lowering the threshold of who should be tested. And so absolutely, yes, we'll lower the threshold, test as many people as we can, especially in long-term care where older folks maybe don't manifest a fever. We want to, essentially test all of those people if there is an outbreak going on. So yes, absolutely.
Yes, ma'am.
Along those lines, have you considered asking the state medical board to loosen restrictions on telemedicine or having out-of-state doctors help out just to kind of relieve pressure on the medical system here?
Yes, we've been in conversations with individuals at the state medical board regarding a lot of different measures that we can potentially take to relieve pressure on the system here. Dr. Dobbs and I had a conversation about this earlier today. And do you want to talk about just the role of sort of where physicians are today and sort of the practice of medicine in Mississippi?
Okay. So most physicians in Mississippi are underused right now. The clinics are empty and they're not busy. And my wife's a physician, and she's way slower than she normally would be because we've decompressed the system. So what I would say first and foremost is, your local doctor is available almost certainly for your normal medical needs. Certainly telehealth options, or at least starting with a phone, is going to be the best way to start. But we do have adequate healthcare capacity within our state and with our local doctors and providers to provide the care that's needed. We just would prefer it be through a telehealth option when possible, but sometimes it's not possible. Sometimes you need to go to the clinic or see your doctor, and that's perfectly acceptable because we know people are going to need that kind of care at times.
And the other thing that I have been advised of in talking to our medical professionals and our experts and Dr. Dobbs and his team and others is the individuals that end up being hospitalized for COVID-19, and particularly those that are in need of a ventilator. That is a group of patients that require extensive medical help, and it takes a significant amount of time per individual. And so we're looking at ways to expand with capabilities should things continue to get worse. Everything from additional hospital beds to finding ways in which to take existing physicians who maybe aren't working as much. We've got those in the surgical centers that maybe aren't working as much now, and taking even those nurses and others that have maybe chosen not to work for a period of time that may want to come back and help in this national emergency. Ross?
Governor, I know that grocery stores are considered essential businesses, but every day I seem to notice grocery store parking lots are filled to the brim. Do they need to be doing something to limit the number of customers inside their businesses at one time to try to minimize the spread of the virus?
Well, I think that we certainly have to keep our grocery stores open. The supply chain in America is working. We need to go into the grocery store and get the things we need and then get out and go home. We have encouraged repeatedly, and a lot of them are doing this, things like at the checkout line, for instance, if you could just go in and put tape every 6 feet so that people are not bunching up on each other, I think that would be very helpful. And I think that in terms of limiting the number of people in the place, it just depends on the size of the facility and how many people we're talking. But yeah, people do not need to be within 6 feet of one another. There was actually a conversation that I saw with the coronavirus task force, the president, the vice president, about the potential of even changing CDC guidelines and encouraging everyone to wear a mask. To my knowledge, they have not done that yet. They have not told me if they have made that determination. But that just tells you the severity of the situation that we're in, and it also tells you how contagious this virus is when we start talking about doing things like that. Courtney Ann?
I saw a note that cruise ships docked in Gulfport were being directed to depart from the port of Gulfport by the close of business Friday. What risk do we believe they may have posed, or is that something related to the executive order that I didn't notice?
Well, we didn't address it in the executive order. Obviously, cruise ships around the country, and we were hearing really around the globe, and we were hearing this weeks and weeks ago, are an area in which there are a number of people that have contracted the virus. There's a lot of people in really tight quarters, and so I think they're potentially at risk. I was having a difficult time getting accurate information from the various cruise lines that wanted to utilize the port of Gulfport. These are lines that have never utilized the port in the past, and I was concerned about that. I'm not sure how much testing they were doing, but my commitment is to ensure that we can help protect every Mississippian that gets this virus, and that's what we're working to do. Gerald?
Some experts are predicting a major southern swing of this coronavirus. And 20% of deaths in Louisiana were of younger people, 43 in Georgia percent, and 49 and 43 in Louisiana. How can you impress upon younger folks to take this serious and not gather together or do things that could harm themselves?
That's a great question. It's one of the things that we have been urging all Mississippians to do. If you are, no matter how old you are, we want you to not gather in groups of 10 or more. We want you to not leave the home, in fact, if you can avoid it. We think that's very, very important. When we talk about vulnerable, we're talking about those that not only are 65 and older, but also those that have a compromised immune system. In Mississippi, that's a higher percentage of our residents than it is in a lot of other states. That's why I wanted to specifically mention our levels of obesity, of diabetes, of hypertension, of the number of people who smoke in our state. All of those various groups have a higher risk of the virus being very, very dangerous and having a very bad outcome. And so if you are even if you're a younger person, you don't think you have any of those, you may have underlying medical conditions that just haven't been diagnosed yet. The other issue is if you're a younger person and you think you don't have any of those areas and therefore you're not that vulnerable, ask yourself, do I know anybody that fits that criteria? And I promise you, everybody in our state would answer that question, yes. We know somebody that fits one of these criteria or is over the age of 65. And so I urge Mississippians to not only stay at home, but to protect themselves, because if they'll do that, they'll protect their neighbors and their loved ones as well. Yes, sir?
Yeah, Dr. Dobbs mentioned that Mississippi seems to have a higher rate of hospitalization for coronavirus patients. Why do you guys think that is?
You know, it's not entirely clear at this time. I think one of the reasons may be that we do a lot of hospital tests. And so certainly 100% of hospitalized patients are hospitalized. So that could be part of it, but certainly we do have a lot of comorbidities that may be driving that as well. I wouldn't say that we have a clear explanation for that, but we certainly will be looking into that closer.
Yeah, the one thing I will say is I think, particularly with the Department of Health testing, they have been, and with UMC as well, they have been very adamant that they, at least initially, started primarily with testing being done on those who had some of the worst symptoms. And so I think that could just be at this point in time, could just be the nature of the numbers. But I think when all is said and done, there's a very good chance that our numbers as a percentage of those who test positive, both in terms of hospitalizations and ultimately deaths, sadly, could be higher than some other states, much like the stat that I utilized earlier when said that the death rate right now amongst Louisiana residents when compared to New York residents is significantly higher. Part of that is demographics, and part of it is these numbers that I mentioned earlier, and that's why it is so important that Mississippians heed the call to stay indoors, to stay away from their neighbors, allow us to slow the spread of this disease through very smart measures that put everyone in a better chance of success. Ross?
Dr. Dobbs, can you talk about the outbreaks at the long-term care facilities and that graph on the website that you guys put out? Is that one, when you have the number one, that's one,
What nursing home? Right,
Okay.
right. That's one nursing home. So we've had 22, and we consider an outbreak a single case or a single employee because we know how deadly it can be. And so whenever that happens, we launch our normal sort of response in that situation.
and you said you guys are taking extra resources to deal with that. Can you talk about that?
Yeah, so whenever we have an outbreak in a nursing home setting, there's a whole, and this is not something new to coronavirus, but when we've had flu outbreaks or other respiratory viruses, because that can be really devastating for a vulnerable population. There's a whole sequence of steps we take as far as like enhanced isolation guidelines, quality control measures that we share with them and we'll monitor to make sure they're doing them. So it's mostly that sort of resource, but also we are resourcing them with protective equipment too. So that's one of our priority areas is if someone has an outbreak in a nursing home, then we're then sending them more protective equipment.
I had a woman reach out to me this afternoon and said that her mom was in a nursing home with dementia and that she'd only been able to get in contact with the nursing home about once a week. And she wanted to know why Mississippi can't, like Louisiana is doing, release the specific names of the nursing homes where there is an outbreak.
You know, that's come up a couple times. I know it's something we've never done for nursing home outbreaks. We want to protect the anonymity of the people who are ill, and we also want to protect the and not stigmatize the nursing home facility. It's not something we've ever done and haven't considered doing it, but if there were a compelling reason to do it, we might reconsider.
Someone who's hospitalized that don't have insurance because of COVID-19, how are they expected to pay for the coverage? I know that the cost ranges from thousands of dollars. How are they expected to pay for it, and will the state assist in paying for it?
Well, what I would tell you is the hospital administrators that I've spoken to, and I have spoken to many around the state, they're not turning people away. They are taking in every patient, every Mississippian that needs care, and they are caring for them. There was a recognition by the U.S. Congress that this is a situation that is very difficult, and because of that, in the most recent bill that passed the Congress that was signed by the President Friday night, there's $150 billion for states and cities and local governments, but there's also $130 billion in that bill specifically for hospitals. Now, my team has advised me much more on the provisions that deal with the state governments and the monies that we are going to receive. I'm sure my team has looked at the provisions for hospitals and been working with individual hospitals on that, but I'll have to get back as to exactly how that's laid out. For instance, on the state monies, there's $150 billion. $11 billion of that is reserved for Indian tribes and the District of Columbia. Of the remaining $139 billion, it is allocated 55% for states, 45% for cities who have a population over 500,000, and every state is guaranteed a floor of how much money they will get. But I don't know exactly what that breakdown is on hospitals, but I'll get my team to brief me on that and hopefully be able to answer that question later as to exactly what it is. Yes, ma'am.
With the stimulus package, are there any portions of those federal funds that you anticipate that you won't accept, maybe because Mississippi doesn't need it, or there's some part of it that doesn't apply to us?
I don't think that is going to be an issue based upon our analysis at this time. Yes, sir.
Director Michelle, do you know if any of those supplies that you guys are getting, are they going directly to nursing homes at all, any of that PPE?
So again, on the distribution of the PPE, the priority on that is to the Tier 1, and nursing homes that are treating COVID patients fall into the Tier 1 category. So they will continue to get the priority, a lion's share of that PPE, and then the difference in that would be then pushed down to the counties and facilitate the Tier 3, which would be your first responders and folks who would be out working and doing public service type work.
And let me just mention something about supplies and PPE equipment. And I say this because I've heard from the president and the vice president repeatedly that everyone should continue to work their supply chain. If you are a large hospital system in Mississippi, every single day you're purchasing PPE and other things. The supply chain right now and the constraints are very tight. I understand that. But the reality is if I am a purchaser of PPEs every day of every week, every year, and I have contracts in place with suppliers, I have significantly more leverage to get supplied than do the state of Mississippi. Now, admittedly, we maybe have more resources and things such as that, and we are putting those resources at play. We are literally working day and night. I'm having calls with Director Michelle and his team at 10:30, 11 o'clock at night as they sit over at our headquarters working supplies all around the globe. But again, I do, and we're going to do everything we can to make sure that we receive the supplies that are needed for our entire state. But if you are a hospital facility, you have leverage with those folks who supply you. 6 months from now, I'm probably not going to be in the business of buying PPEs from the state's perspective. But 6 months from now, every single hospital facility is going to be in the market for buying PPEs as hopefully by that time we're returning back to normal and we're back to doing surgeries and things such as that. And so this has got to be a team effort. We're going to do everything in our power to make sure that we have the necessary supplies available, but we need everyone trying to do the same thing and trying to leverage whatever contacts, whatever resources you have to fill this need. Gerald?
The federal government is in a very early stage of the next phase of the stimulus. Is there anything you would like to see in that was not in the previous stimulus?
We're working on that. We were actively engaged in the previous bill. Obviously, we had the occasion of working very closely with our delegation, and I want to thank our federal partners, all of whom are working in concert to help the state of Mississippi. We do have some understanding in Mississippi about what is needed in times of natural disasters, having gone through Katrina, having gone through the BP oil spill. We've got either fortunately or unfortunately, depending on your perspective, we've got experience in Mississippi that many other states have not ever had to deal with. And so we've been working with the Congress where it made sense, and certainly working with our delegation and some in the leadership as well, and we will continue to do that. I don't have a specific ask at this point. Let's not forget that the bill that just passed had $2.2 trillion in direct financial impact, and another $4 trillion in allowances for the Fed and other governmental entities to provide liquidity and other things to the system. Pretty unprecedented in American history. And so, some of my colleagues, the president signed the bill on Friday around 7 o'clock or so, and some of my colleagues were starting to put together their wish list by 7:15 for the next stimulus. We're focused on other things right now, but we've got a team in my office that is working on that, and we'll figure that out as we go forward. Yes, sir, Rogelio.
Dr. Dobbs, you mentioned that we have an enhanced number of testing centers now statewide. Is the requirement still to be recommended, that a person has to be recommended to go there to be tested, or can just JQ Public walk up?
Oh, yeah, so these are private clinics, these are physicians' offices, these are health systems, and so everyone's going to be different. Certainly, under every circumstance, we recommend people to call ahead and go in and get tested. But yeah, any patient should have access. Now, we have had a lot of questions about people who may be uninsured, and we're really excited that the community health centers across the state have picked up that responsibility as well. So really, pretty much everybody in the state of Mississippi, although I know there's some geographic challenges in different parts of the state, should be able to get access to testing.
And I will tell you, since Dr. Dobbs mentioned it, a provision in the federal act that passed and was signed on Friday night provided significant resources to the FQHCs to help with that effort. So that's a provision that I fully support and have tried to support throughout the way. Hey, Ross.
Governor, are gun shops considered essential businesses, and are they going to remain open?
As far as I know, they are considered essential businesses. I don't have the list in front of me, but I'll take a look at that and we'll get back to you.
Why would they be considered essential businesses?
Well, I think if you see what's gone around in the entire country, the fact that we have a constitutional right, a Second Amendment right to bear arms. Virtually every, not every, but most every governor, Republican and Democrat alike, have worked to keep those shops open. And I actually saw some statistics earlier today. The number of purchases, acquisitions, and other things have gone up significantly in the month of March. And so I trust that our gun store owners in Mississippi will heed our call and make sure that the social distancing guidelines are definitely done in their stores, and I think that's important.
Real quick on that, a little bit devil's advocate. I mean, you mentioned that, folks
A little bit of devil's advocate, or a lot?
Just a little, or maybe a lot, yeah. Folks have a constitutional right to bear arms. I mean, folks also have a constitutional right to peacefully assemble, but that's something that we're limiting right now. Why do you think that the constitutional right to bear arms, if we're limiting other constitutional rights at this moment?
I believe that we can have gun stores open, and we can do it in a way where social distancing guidelines, where gathering of groups of 10 or more in a confined space can be adhered to. Therefore, we are doing it in such a way in which individuals are able to secure their rights without putting other people at risk. And that's the key, is much like an individual can go into a grocery store, socially distance, provide food for their family, they can do the same thing in a retail store such as a gun store.
George or Michelle, yesterday you talked about how there was like a 4-day delay in getting some supplies. Could you just explain a little bit more just how that whole process of kind of going out and getting some of this PPE kind of just works, or to the layperson, is this PPE coming from a single company? Is it multiple companies? Is it around the United States, international? Just how does that work?
Sure, yeah, and I'll try to address that as quickly as I can. The bottom line, I think that a lot of people have difficulty understanding is, why can we not get PPE? I mean, it's out there, and it starts with the global demand on this PPE that started back when China drained a lot of the PPE, because a lot of this is made overseas. So you combine that with the outbreaks across the world, purchases started going about. The national stockpile was not designed to handle a global pandemic. It just was not, and it's been clearly talked about and recognized, by our federal government on that. But then that'll be talked about later. The key now is to get through and to fight our way out of this. So the sources you asked about where we're getting stuff is coming from multiple sources. We're having to buy it through basically through contacts that know where the sources are. They're coming out a lot of directly out of the factories. In some cases, the same places that would have supplied the national stockpile. We've been fortunate to be able to develop our own air freight to come in from these places into the United States. The delay that you mentioned earlier came about by just us, again, as the governor has mentioned, this is something that we've never experienced before. So we've been working through this. And I've said a number of times, it's just kind of walking on the moon type stuff, so to figuring it out. So the delay came about in identifying credible sources and getting the supply chain started.
Yeah, and I'll also just point out part of the delay was early on. The federal government was also a bidder in many of these available masks, and they were successful in winning some of those contracts. And because of where we are in the cycle, a large number of that material initially went to the state of New York, state of New Jersey. Let's remember that I think we have approximately 230,000 cases in America today. By the way, I believe the numbers that the 50 states are reporting. We have approximately 230,000 cases in the U.S. today, and half of them still today are in either New York or New Jersey. Those two states combined have close to 120,000 cases. And so you understand why at least that which is in the federal stockpile has moved there initially, because they're on the front lines. But the virus is spreading rapidly. It's the reason that we're taking very aggressive steps and aggressive actions to deal with it.
Yes, I have a question for Dr. Dobbs. Have there been any updated regulations to nursing homes to prevent the spread of the virus in those facilities?
Early on, right when they had a case in Tennessee, we sent out guidance about visitation restriction and those sorts of things. So that has been implemented for a long time. It's really more guidelines and like in regulations, so to speak. But we've had extremely good compliance with that because we don't need people coming in and out that don't really have to be there. I know it's been kind of hard on families, but even a single chink in the armor can really let the disease in, and once it gets in there, it's really, really difficult. And then once we have an outbreak in there, then we really do go in with a lot more aggressive oversight and a lot more aggressive guidance so that we can really prevent any additional transmission as best we can.
So y'all haven't been changing that since we see more and more nursing homes have those cases?
Haven't been changing.
Have you been, has the health department been changing those guidelines as we've seen more and more cases come out?
Well, the guidance has been more restrictive as far as like being more robust and keeping folks out. At first it was a little bit on the best judgment sort of side, but obviously now we just need to keep all visitors out. Yes, sir.
And I will tell you, at Dr. Dobbs' recommendation, my executive order from about 10 days ago restricted visitation at all nursing homes. That's a very hard thing to do, by the way. And I've heard from many great Mississippians who have not been able to get in and see their loved ones, and that's really hard. But it is the best thing for those patients, and it's the best thing for their families in the short run. This is going to be over at some point. We are going to get through this, and we're going to do it in a responsible way and protect Mississippians to the full extent possible. And so it is a short run decision. It's heartbreaking to have to do it, but it is the right thing to do.
Dr. Dobbs, yesterday we talked about the number of ventilators in the daily inventory. Have you given any more consideration to releasing that number?
We've looked around at other states and what they're doing and kind of figuring out what the benefit or what the downsides might be. There does seem to be some utility in getting more data on the number of patients who are in intensive care and making that more obvious, and then also to the number of COVID patients who are on ventilators. That certainly makes sense. As far as like the total number of ventilators, it's not really a simple question because a lot of the ventilators are not really ventilators. They're basically operating room machines and stuff like that. So we're still looking at that, but we don't want to give information that's misleading, either that we have more than we have. There's a quality issue in that as well. So at this time, we're not planning on doing that because we don't think it's that useful. But obviously, anything that's helpful and not harmful, we'll continue to keep that in mind. But you will see additional information as far as as it regards to COVID patients themselves.
The other thing I will tell you with respect to that is there is a recognition that with the very quick spike in New York, the challenges that came from a ventilator standpoint, we have identified approximately 500 ventilator machines that we are asking Mississippi State University to equip to basically change from battery-operated ventilators to where they can be plugged into the wall, and they were glad to take on that task, and we think as early as next week we can start getting some of those. Now, again, Dr. Dobbs talks about quality. That is probably not as high a quality ventilator as the one that's in the ICU out at UMMC, but it'll work, we think. We are advised that it'll work for a period of time. In addition to that, we are out shopping for more ventilators for our state. We feel confident that we'll be able to get some in, and that's something that we're going to continue to work towards because we think that's important. But the other piece to that is those machines do not operate themselves, and that's the reason we are urging healthcare workers that are either not working right now for whatever reason. We're urging healthcare workers that are underutilized right now. We're talking with physicians and others as to putting together groups that can help staff these different facilities, because that is critically important. We've got to have people as well. Now, what's happened to our neighbors to the west is the federal government has put resources in, and so we try to take the approach that we will ask the federal government for help in the event that we need it, but we know that their resources are strapped in this as well. So we're going to do everything we can in this short run to slow the virus, to utilize our supply chain contacts, the resources that we have to reduce the risk to Mississippians. Yes, sir.
When it comes to small businesses that are considered non-essential in this time, what's in place to help them out as they begin to shut down their doors tomorrow night?
Well, there's a number of things in place for small businesses. The single most important one is obviously we have SBA loans that have already been approved, and so small businesses can utilize the SBA loans in the short run. The package that the president signed, part of the $2.2 trillion was the ability of small businesses, those less than 500, to access additional loans that are forgivable, to pay for individuals that are kept on the payroll, as well as to pay certain expenses like rent, etc. The small businesses around the state are of significant concern to me, to our team, because we understand how hard people work. The other thing that we've done is for those small businesses that maybe only have one employee, or for those individuals who are self-employed, the federal bill allows for them to file for and receive unemployment insurance benefits. And so each employer has to figure out what is in their best interest and which program to take advantage of, but there are numerous programs in place for each of them. Thank you all very much for having us today. We'll see y'all soon. Please stay safe and continue to pray for our healthcare workers.